Hi everyone, my name is Ibrahim Amin. I would like to briefly discuss with you about Oculomotor knife. As we all know that Oculomotor is a third cranial nerve and it says the nerve that supply both parasympathetic and motor innervation. So actually it is a mixed nerve. So we're gonna look forward into details about Oculomotor nerve. As we all know that the oculomotor nerve is the third cranial nerve. It provides motor and parasympathetic innervation to some of the structures within the bony orbit. So here we're gonna be looking about anatomical cause of it, the function and the clinical correlation. So the motor innervates the majority of the extraocular muscles, which include the levator superioris, the superior rectus, the inferior rectus, the medial rectus, and the inferior oblique. The parasympathetic supplies the sphincter pupillae and the ciliary muscles of the eye. It also gives a little branch of the sympathetic fibers which run within the oculomotor nerve to innervate the superior tarsal muscles which help to raise the eyelid. So here we're gonna be looking onto the anatomical cause. The oculomotor nerve, as we all know, originates from the oculomotor nuclei, which is located within the midbrain of the brainstem, ventral to the cerebral aqueduct, and also emerges from the anterior aspect of the midbrain, passing inferiorly to the posterior cerebral artery and superiorly to the superior cerebellar artery. And then the nerve then passes the dura mater and enters the lateral aspect of the cavernous sinus. And within this cavernous sinus, it receives sympathetic branches from the internal carotid plexus. So when the nerves leaves the cranial cavity via the superior orbital fissure at this point, it divided into superior and inferior branches. The superior branches provide motor innervation to superior rectus and levator superioris. It also provides sympathetic fibers which run with the superior branch to innervate the superior tarsal muscles. The inferior branch provide motor innervation to the inferior rectus, medial rectus, and inferior oblique, and also supplies the preganglionic parasympathetic fibers to the cerebellar ganglion. So what are the function of this nerve? Here we're gonna start with the motor function. The motor function of the oculomotor nerve innervate many of the extraocular muscles, which include the superior branches. The superior branch, which include superior rectus, levator superioris, and some of the sympathetic also fibers from the superior branch of the oculomotor, they all innervate the superior tarsal muscles. And then the superior branch also which include the superior rectus, elevate the eyeball, and the levator superioris, which raises the upper eyelid. Well, the inferior branch, which include the inferior rectus, which depresses the eyeball, the medial rectus, which adducts the eyeball, and then the inferior oblique, which elevate, abduct, and lateral rotate the eyeball. So we're gonna look forward to the parasympathetic functions. There are two structures in the eye that receive parasympathetic innervation from oculomotor nerve, which are the sphincter pupil, which constrict the pupil, reducing the amount of light entering into it, and we have the ciliary muscles, which contract, causing the lens to become more spherical. So we're gonna look through the embryology of the oculomotor nerve. The oculomotor nerve and its associated cranial nerve nuclei exist within the midbrain. And then the midbrain develops from the mesencephalum, neuroblast from the basal plate develop into the tegmentum. Then the tegmentum embodies the cranial nerve of the third, the fourth, the edingo-westphal nuclei, the oculomotor nuclei, the trochlear nuclei, the red nuclei, and the reticular nuclei. And also the cranial nerve tree has the somatic and autonomic functions, which are homologous with ventral root of the smaller nerves, and they all originate from the basal plate and innervate the superior rectus, inferior rectus, and the medial and inferior oblique muscles. So what are the blood supply and the lymphatic of this nerve? The somatic and autonomic component of oculomotor nerve have the differentiated vascular supplies. For example, like the vasa vasorum supplies the inner somatic voluntary nerve fibers, while the pia mater blood vessels supply the outer autonomic nerve fibers. The lymphatic drainage of the orbit is not yet well understood. So we're gonna look through also the pathway that indulges. Both the somatic and visceral motor axons exist the anterior surface of the brainstem as the oculomotor nerve, appearing from between the midbrain and the pons, passing between the posterior cerebral and the superior cerebral arteries. From here, then the nerves run anteriorly into the subarachnoid space and the medial to the much larger trigeminal nerve, trigeminal nerve, and then its ganglion. Then it continues to plasmadural matter, and then now passes through the superior and then crosses behind the superior lateral aspect of the wall of cavernous sinus, lateral to the internal carotid artery, and then passes into the cranial cavity. So, what are the clinical relevance? As we all know, recognizing oculomotor nerve dysfunction is a crucial because it can be a sign underlying or uncontrolled chronic diseases, which is essential clinical symptoms that can be life-saving in certain circumstances. So we're gonna look through the pathophysiology. The cause of the oculomotor nerve palsy is most commonly by microvascular diseases, which include diabetes, hypertension, compression from an intracranial neoplasm or an aneurysm, even trauma. So mostly the microvascular diseases affect the vasa vasorum. So what are the clinical signs? We have droopy eyelid, which is due to paralysis of the levator superiors. We also have the diplopia. In other words, it means seeing double due to misalignment of the eyes. And we also have some abnormality swinging and some abnormality due to dilated pupil, which caused by lack of parasympathetic innervation. Here, we can look through